Hello, my name is Zilin. Welcome to my poster. Thank you for visiting. So I'm just going to spend a few minutes giving a brief overview of my project, and then feel free to ask me questions, I think is the format. So in terms of the introduction, some things I wanted to highlight were that Asian Americans have one of the lowest utilization rates of mental health services, almost 3 times lower than that of non-Hispanic whites. And in a study of over 40,000 college students looking at mental health disparities in students of color, the researchers found that the Asian students that did present to seek help often had greater distress at that point, and only about 20% of Asian students that had a mental health problem would seek help for them. And beyond college, in a study done at MGH, Asian patients were only half as likely to be diagnosed with a mental disorder, and of that group that had a diagnosis, only half as likely to receive medication when compared to non-Hispanic whites. Stigma especially plays a large role in this disparity, as Asians tend to report greater shame and embarrassment, and also greater difficulty in seeking mental health treatment. And of course, the pandemic this year has not made things any easier, but I think it highlights the benefits of having mental health resources and stigma interventions online, as opposed to only in-person things. And most of the available resources that are online tend to focus on a younger English-speaking non-Asian population for the most part. I think it's also important to think about how, like, when we talk about Asians, this is actually a really large group of different cultures, different languages. And so I think that adds difficulty in terms of when you're trying to target specific groups and make it more culturally appropriate and um, in the right language. And so what we wanted to do here, since I'm Chinese and I figured it would be easiest to start with my cultural background, we're delivering a new stigma reduction intervention that's kind of like really catered and focused on Chinese culture and targeted towards the Chinese communities that are local. And so, for example, what we're doing is we're doing everything in a bilingual way, using both languages. We're using both like English and Chinese. And then we're also publishing content on WeChat, which is a social media app that like the majority of the Chinese community uses. And so talking a little bit about our research design, again, as I said, our intervention itself is based around social media. And so basically what we did is we first distributed initial surveys before starting our social media campaign, and then we launched the social media pages, including WeChat. And then every 3 to 4 months, we're distributing surveys again to see if there are any differences in mental health attitudes. And so kind of looking at our preliminary results from the first survey, of the Chinese people who took the survey, those who took the survey in Chinese language tended to report less knowledge than those who took the survey in English. And so this kind of suggests the need for more mental health education and resources for those whose primary language is Chinese. In terms of age, we found that an increase in age was associated with higher stigma when controlling for survey language. And interestingly enough, in terms of acculturation, within the participants who took the survey in Chinese, the more acculturation you had in terms of like, so that means more westernized, that was significantly associated with a decrease in stigma, but this effect was not seen in those who took the survey in English. And overall, those who took the survey in English reported higher levels of stigma, which was not expected. So I thought that was kind of interesting. And so this is, just like a quick preliminary analysis. So we found that Chinese language participants who tended to be older and less acculturated exhibited lower levels of stigma, possibly because they're less aware of stigma as a problem. Although I think there needs to be, we have a lot of ways to go in terms of like looking at this data further and what it means. And so our results also suggest that there's a large population of individuals whose first language is not English, with a significant need for more mental health education. And so I think this provides evidence of the need for greater diversity in providers and in general how we talk about mental health to our patients from different cultural backgrounds. And so we plan to continue sampling this population as our initiative progresses, using the data to improve our efforts and guide our future directions. Thank you for listening.